The anticancer preparation NSC 631570, Ukrain, in the treatment of malignant melanoma, by Dr. Vasil Novitsky from Novitsky Pharma and the Ukrainian Anti-Cancer Institute, Vienna, Austria, and Professor Larissa Skivka from Taras Shevchenko National University of Kiev, Ukraine. Malignant melanoma is one of the most deadly skin cancers. Once a rare cancer, the incidence of malignant melanoma skin cancer in most developed countries has risen faster than any other cancer type since the mid-1950s. About 132,000 new cases of melanoma are diagnosed worldwide each year, according to the World Health Organization. Melanoma strikes individuals in the prime of their lives, median age 52 years old, a decade before most solid tumors arise, such as breast, colon, lung, or prostate. The diagram shows how the chances of death or cure are strongly influenced by the depth of the melanoma on diagnosis. At the early stages of melanoma development, patients are treated surgically, but the advanced disease is virtually incurable. Numerous clinical investigations have been conducted to improve the efficiency of melanoma treatment. Nevertheless, biologists and clinicians continue working on possible new methods of treatment and searching for new therapeutic agents, as drug resistance is a commonly observed problem. NSC 631570, Ukrain, is an anti-cancer agent created on the basis of alkaloids from the plant Chelidonium majus L, greater celandine. NSC 631570 has been used for cancer treatment for more than 40 years. Monotherapy and combined application of NSC 631570 have been successfully used for the treatment of malignant melanoma since 1996. The continuing story of the anti-cancer preparation Ukrain and its use in treatment is told in the book The Suppressed Cure for Cancer by Eleonore Thun-Hohenstein and is available at Kindle. Search Kindle for The Suppressed Cure for Cancer. The autofluorescence of NSC 631570 Ukrain in ultraviolet light. Here we see the uptake of Ukrain in melanoma cells compared to normal cells in vitro. Above the melanoma cells, below the endothelial cells, with the high uptake and the low uptake. Results of the NSC 631570 study at the National Cancer Institute, Bethesda, Maryland, USA. The cytotoxicity of Ukrain and 5-fluorouracil against different cancer cell lines was compared. We see the results for 5-fluorouracil in blue and those for Ukrain in red. And whereas the maximum achieved by 5-fluorouracil was growth inhibition, Ukrain actually led to a loss of cell biomass. The purpose of this report is to describe experience of the use of Ukrain in the treatment of malignant melanoma and to describe some of the preparation's mechanisms of action. Here we see an in vitro experiment design. B16 melanoma cells of C57BL6 mice were kindly supplied by the Bank of Cell Cultures and Transplantable Experimental Tumors of R.E. Kavetsky Institute of Experimental Pathology, Oncology and Radiobiology, Kiev, Ukraine. MM4 cells exhibiting a relatively low metastatic potential were established from the primary lesion of subcutaneously injected B16 cells. MM4M2 cell lines, established by two sequential passages of lung metastases of MM4 cells after intravenous injection, are highly metastatic. Cells were cultured in vitro in Dulbeco modified eagle medium from Sigma St. Louis, USA, supplemented with 10% fetal calf serum, penicillin at 100 micrograms per milliliter, and streptomycin, also at 100 micrograms per milliliter, at 37 degrees centigrade in 5% CO2. To determine the effects of Ukrain, obtained from Nowitzki Pharma, Vienna, Austria, on cell viability, cells were treated with Ukrain at different concentrations: 1.6, 3.2, 6.4, 12.5, 25, 50, 100, and 200 micrograms per milliliter for 24 hours and 48-hour periods. Cell viability was determined by MTT test. HMGB1 level in conditioned medium was evaluated by ELISA. TAP mRNA was examined by RT-PCR, and TAP protein in cell lysates was determined by Western blot. Treatment of B16 melanoma cells with Ukrain at apoptogenic concentrations induced dose-dependent tumor cell death accompanied by dose-dependent release of HMGB1, more in high metastasizing cells. The levels of HMGB1 in the cell probes treated with the drug exhibited a strong correlation with the levels of cell death. We found a significant increase in the number of mRNA for TAP1 in melanoma B16 cells after treatment with Ukrain at the non-apoptogenic concentration, whereas only a trace quantity of the TAP1 mRNA was found in untreated cells, as you see in A, top left. Treatment of melanoma B16 cells with Ukrain increased expression of mRNA encoding TAP2 by threefold. P is smaller than 0.05, as you see in C, top right. Increase of TAP1 protein's expression was confirmed by Western blot analysis on the left in B. It is known that correction of TAP1 and/or TAP2 defects in B16 mouse melanoma enhances the cell surface expression of MHC class I molecules and significantly reduces the rate of subcutaneous tumor growth and pulmonary metastatic burden. Treatment experience with Ukrain. A leading Austrian dermatologist and melanoma specialist, Professor Dr. Peter Wodnianski, remarked that Ukrain can save patients' lives. On the 12th of June 1984, he reported his good result and requested that the potential of Ukrain should be investigated in a clinical study. He wrote, "This completely exceptional result impressed me so much. With a melanoma patient who is already excreting melanin in the urine, one can hardly expect months, that I requested Professor Dr. Klaus Wolf, head of the First University Skin Clinic, to test Nowitzki's preparation clinically. Patient SS, an 8-year-old boy, presented with an ulcerating lesion of the nose. At the age of 10 months, xeroderma pigmentosum was diagnosed. Until the age of 3, the number of skin lesions increased considerably. In May 2002, skin cancer, squamous cell carcinoma, at the nose was diagnosed, T4NXMO, histologically verified. From May till June 2002, 3 cycles of chemotherapy were administered, cyclophosphamide, vincristine, vinblastine. The therapy failed and the tumours grew. Clinical investigation in April 2004 revealed deforming malignant melanoma of the nose with invasion into the cartilage of the nasal septum, measuring 3 by 3 centimetres. On the 20th of May 2004, therapy with Ukrain was started, 5 milligrams intravenously twice a week, up to a total dose of 85 milligrams. 1 month after the last administration of Ukrain, a complete regression of the tumour was revealed. The skin defect was partially replaced with connective tissue. Xeroderma skin lesions improved throughout the body. In the left-hand picture, we see the patient SS before therapy with Ukrain. The middle picture shows the autofluorescence of Ukrain under ultraviolet light in the melanoma area during the first intravenous injection in May 2004. On the right, we see the patient in December 2004. A complete regression of the tumour with connective tissue substitution has taken place. The second patient with the same diagnosis, xeroderma pigmentosum, is Daniel Broschart from Germany. Before his 16th birthday, he had to undergo 54 surgical operations. He is now 32 years old. After treatment with Ukrain, he now works and drives a car. On the left-hand picture, we see Daniel aged 6 with multiple skin tumours. In the middle, Daniel after a big transplant operation. And on the right, Daniel in January 2012. Another example of Ukrain in the treatment of malignant melanoma. The patient VK, 59 years old, with a malignant melanoma of the left parotid aries, stage 4, multiple skin satellites, head, back, neck, right supraclavicular, thorax, and multiple metastases to the lungs, 4 to 28 millimeters, liver, 6 to 15 millimeters, and spleen, 10 to 22 millimeters. On the right, after 4 courses of therapy with Ukrain, only 1 skin satellite, 1 lung and 4 spleen metastases, no liver metastases, and now no skin lesions, only 1 lung metastasis, 14 millimeters. Here on the left, we see the patient VS, 46 years old, with a malignant melanoma of the skin with satellites sized from 10 to 33 millimeters before therapy with Ukrain. On the right, 2 weeks after the start of therapy with Ukrain, the treatment was ongoing. We've thus seen the effects of NSC 631570 Ukrain on melanoma cells, leading to an increase in TAP proteins, HMGB1 release, and apoptosis. Ukrain exhibits a powerful therapeutic effect in the treatment of malignant melanoma. The drug not only selectively kills tumour cells, but also recovers the role of the dying primary tumour as an effective immunogenic hub. If you have any questions, please feel free to contact us. Here you see our email addresses. So thank you once again from Vasil Novitsky and Larissa Skivka.